I'm Angie DeMichele. I am a medical oncologist and professor at the University of Pennsylvania. I focus in breast cancer. I take care of patients, I teach, and I do research that is geared toward helping us understand how to better treat breast cancer to help patients have better outcomes. I wanted to be a doctor since I was in second grade. It wasn't so much thinking about being a scientist at the time, but more about just being a person who could take care of other people's problems and help them feel good. You know, when I was in high school, my mother had a really serious medical problem. So I have two younger siblings, my sisters Kara and Caitlin, and after the second one was born, my mom had a stroke. I was a sophomore in high school, and I was taking care of a 19-month-old and a 2-month-old, and it was a situation where I realized how medical catastrophes can come out of nowhere. One of the things I tell people is, you've always lived very healthfully, and that's going to help you. My job as a doctor is to help my patients reach their goals and to do it in the way that feels most consistent with what's right for them. A couple of weeks before we get those results. You know, a diagnosis of metastatic breast cancer is, of course, a devastating thing for a patient to hear. And I think it takes some time to really wrap your head around the idea that I'm gonna live with breast cancer for the rest of my life. But the way I approach it is, that's what you're gonna do. You're gonna live with this breast cancer. We're gonna do what we have to do. We're gonna be attending to that cancer. I am gonna make sure that we are on top of it. Our goal is to say, how are we gonna live with this? How are we gonna figure out a way to let your life be the life you wanted it to be, despite the fact that you have metastatic breast cancer? And even though we've made great strides in curing so many women, until we get to 100%, every single patient is going to worry and have to live with the fear of that breast cancer coming back. So it seemed to me that the most important thing I could work on was figuring out how to prevent that recurrence from happening. And so about 10 years ago, I really shifted the direction of my research. I started to work with a wonderful partner, Dr. Louis Chodosh, who has been working in the laboratory to understand, how does breast cancer metastasize? Why does it come back? And so that partnership, really being able to see what we've learned in the laboratory and then bring that to the clinic, I think it's really key to using the science to help patients directly. So my mentors were Lynn Schuchter and Kevin Fox and John Glick, who really helped to shape my approach to taking care of patients in oncology and also supported me as a researcher and scientist. You know, I love my work. I love my job. I still feel, 30 years in, as if I have the best job that anybody could have. Now, I will say my family is what keeps me grounded. And without Robert and Elliot and Jesse, I would not be able to do what I do. But we are going to take care of this. You are going to be just fine. You know, that high school girl who was thinking that she wanted to be somebody's doctor and she wanted to try to help cure diseases, I now get to live that every day.
Good to meet you too. All right, I'll just walk